Hi, it's Josh Inkle from Hudson and Castle Law, hudsonandcastleLaw.com, 302-428-8800. Today I'm going to talk to you briefly about the three common types of injuries that we see in nursing homes that lead to litigation. First is a fall, second are pressure sores or ulcers, and the third are medication errors. So, the first one, a pressure sore. Generally speaking, if a person is in a nursing home for a long period of time, they may be bedridden. They may not be able to get out of the bed, or they may not want to get out of the bed. So nursing homes have some things that they're supposed to do to make sure that you don't get a pressure ulcer or a bed sore. Those terms are used interchangeably. But essentially what they are, in layman's terms, is if you sit in the bed for a long period of time, your bone pushes up against the bed and the fat, and it pinches and creates a shearing or a friction, and it starts out as a rash, and they can get pretty nasty. It can open the skin, and they can become infected and deteriorate. So they're really nasty things, and they have to be taken care of right away. If you're in a nursing home or a loved one is, and they tell you that you have a pressure ulcer or a bed sore, that's something that you really need to take a look at and make sure there's attention. A couple things that nursing homes can do to make sure that you don't get bed sores or pressure ulcers are to turn and reposition you every 2 hours. So literally they come in and they'll turn your loved one on their side for 2 hours and the other side for 2 hours, their back for 2 hours, and they'll do that every 2 hours all through the night. Another thing they can do is called a barrier cream, which is something similar to a diaper cream, kind of, but not really. That's close enough. Another thing they can do is use a air loss or a pressure relieving mattress, and that will change the pressure in different parts of the body at different times. So those are the three main types of things that a nursing home can do to try to make sure that you don't get, your loved one don't get any pressure sores or ulcers. And if you get one, the treatment is generally the same. Sometimes there's a surgical intervention for the treatment of pressure sores. But what treatment you need, you should leave up to a medical practitioner. Today's video is just to tell you the three main types of injuries that I see that lead to litigation in nursing homes. Also, the Centers for Medicare, CMS, generally find that if a person gets a bed sore or a pressure ulcer, it's only because of negligence. Generally speaking, you can't get a bed sore or pressure ulcer unless somebody did something wrong. There are exceptions to every rule, as the law would state. Another often injury that we see in a nursing home is somebody who falls, and they may fall because they're not getting the assistance that they need to transfer from the bed. They may fall because they're getting out of a wheelchair, or they just may fall on their own. But falls are serious, especially when it comes to the elderly, because it can also often lead to fractures and broken hips, and those can lead to a general overall decline and a loss of will to live. So falls are pretty serious. If you have a loved one who has fallen in a nursing home, make sure you stay on top of their care and that they give the care that they need, and talk to the medical providers. And the last one we see is a medication error. Medication errors can be drastic. If somebody gets a medicine they're not supposed to get, especially if it's over a long period of time, those results can be very tragic. So, like I said, the main three types of injuries we see that involve or result in litigation in a nursing home are pressure ulcers or bed sores, falls with injury, and medication errors that come with injury. Again, it's Josh Inkle from Hudson and Castle Law. That's hudsonandcastleLaw.com or 302-428-8800. Feel free to call with any questions. Thanks. Have a good day. See ya.